Thank you all for joining us today. We'll get started now. Folks are continuing to come in, but we have a lot to get through today, so I want to get us started. My name is Christine Mitchell. I use she, her, hers pronouns. And I'm a research associate with the Health Instead of Punishment program at Human Impact Partners. I want to acknowledge today that I'm calling in from the occupied, unceded land of the Ohlone peoples in Oakland, California. We'd love to get a sense of who you are, who's with us today. So as we get started, please feel free to add your name and your location in the chat. Make sure you select that it goes to all attendees and panelists. We also want to let you know that the session is being recorded and it will be emailed out to all registrants following the webinar. So a few technical notes as we begin. We are offering closed captioning for this event. So if you want to view the captions, click on the closed captions button, which is at the bottom of the screen. If you have trouble with that, Sophie will repost the link to get to the closed captions in the chat right now. And thank you to Sherry, who's on the line, captioning the webinar live for us. Everyone is muted, and you'll be muted throughout the webinar, but you can drop your questions into the Q&A box, which is also, there's a Q&A button at the bottom of the screen. Next slide, please. So I want to begin today by acknowledging where we are, what moment we're in. The widespread uprisings against police violence are occurring across the United States, sparked by the murders of George Floyd, Breonna Taylor, Tony McDade, and countless others, including those whose names aren't in the headlines. At Human Impact Partners, we feel collective grief and rage for the stolen lives of people killed by the police and for the brutal and ongoing injustice that Black people face in the U.S. We're in solidarity with the communities who are led by Black organizers who are putting their lives on the line in the face of a militarized police response that includes tear gas, batons, and bullets, even as a global pandemic continues, to make clear, yet again, that Black lives matter and to demand systemic changes to policing. Some of you on this call might have direct lived experience with police violence yourselves. Those of you who have lived this don't need academic journals or professional organizations or a webinar to declare that policing is a public health issue to know that it is. But still, we're living in a society that operates within systems of capitalism and white supremacy culture, and the data matter when we speak to those in positions of power. We in public health have a role to play in using our positions, the letters after our names, our knowledge, our research, and our connections to spheres of power to speak up against this crisis. Finally, I want to note that this can be a deeply personal and deeply challenging and traumatizing topic, especially for those who face the daily threat of policing. So please continue to check in with your body and your heart throughout the webinar. And if at any point you need to step away or log off, please take the space you need to take care of yourself. Next slide, please. So for those of you who are new to Human Impact Partners, we are a national nonprofit organization. Our mission is to transform the field of public health to center equity and build collective power with social justice movements. And we do that work through advocacy, through organizing, capacity building with governmental public health, and action-oriented research across the issue areas listed here. Next slide, please. Can you go to the next slide? Thank you. Our community safety work, which focuses on the criminal legal system, including policing, incarceration, immigration enforcement, and surveillance, falls under our Health Instead of Punishment program. So the vision that HIP shares for this program is a vision of a society where all people are healthy and free. For us, that means a society where we wield our collective resources to help, never to punish or hurt, where all people get the care and assistance they need to repair any harm they have caused and heal historical or ongoing pain and grow in community together, where there is no need for prisons, jails, detention centers, or policing, where all people can thrive. Next slide, please. So we start today with a quick sense of the scope of the problem of policing in the US. Historically, policing evolved from ruling class efforts to control the immigrant working class in the North and efforts to control Black people via slave patrols in the South. Many of the practices and policies that are still enacted by police today are founded in a racist history of social control over Black and Brown communities. According to data from the Mapping Police Violence Project, 1,099 people were killed by police in 2019, with Black and Indigenous people being 2 to 3 times more likely to be killed by law enforcement than white people. However, mortality is not the only health impact of policing. Even in the absence of physical violence, stops by police have been associated with adverse mental health outcomes, including symptoms of anxiety, depression, and post-traumatic stress disorder. And again, data show that police are disproportionately stopping Black residents. Next slide, please. So knowing that policing is a public health issue, what comes next? In 2018, the American Public Health Association, APHA, passed a policy statement on law enforcement violence. Importantly, the statement urges solutions that take an upstream structural approach to addressing policing, rather than the oft-touted solutions that look at police violence as a result of some bad apples and offer individual level reforms. 2 of the co-authors of the APHA statement are here to talk with us today about the state of research and organizing on policing as a public health issue. Next slide, please. So our first speaker will be Catherine Duarte, a social epidemiologist whose work focuses on education policy around school discipline and other manifestations of the criminal legal system in schools. Her work seeks to document and understand the impact of these exposures on inequity in young people's health and well-being. She is currently a PhD candidate in epidemiology at UC Berkeley's School of Public Health, an RWJF Health Policy Research Scholar, and teaches in the Department of Health Education at San Francisco State University. She lives in Oakland, California. After Catherine will be Omid Bagari-Garakani, a health policy advocate focused on system change that prioritizes health and well-being above all else, necessitating public health workers and others interested in health to address state violence and support shifting resources to community-led health strategies. He teaches critical race theory at the University of Washington School of Public Health and provides capacity building support to legal advocates in Washington state. Omid was born in Iran, has lived the majority of his life in the US, and currently resides in Seattle, Washington. After Catherine and Omid speak, there'll be an opportunity for Q&A, so please feel free, as they're presenting, to submit your questions, again, via the Q&A box at the bottom of the screen. Catherine, I will pass it to you.
Hello, everyone. I want to start by thanking Human Impact Partners for holding this space and all of you for joining this conversation. I'm feeling grateful to be in community with you all this morning. And there are hundreds of people on this call from all over the country. And I know you all carry this work in different ways. So we have organizers on the call, we have health department folks, we have researchers and educators and people with lived experience. We have folks who identify with all the above and more. And so our goal is to recognize the collective knowledge that we all bring and the strength in coordinated actions that can inform. So I look forward to, and I encourage you to share examples of the ways in which the action steps we discuss present in the work that you do and that you have been doing. So building from what Christine just shared in this first section of the webinar, I've been asked to summarize the content of the APHA statement, particularly focusing on the opposing arguments that the statement deconstructs and the evidence-based strategies that inform the statement's recommendations. And in doing this, I'll discuss the broader role of research in this work, different data sources that were used to develop the statement itself, what those data suggest are or are not effective public health strategies to intervene on law enforcement violence, and where there may be gaps in need of addressing. And then from there, I'll hand over to Omid, who will discuss specific action steps and the ways in which the statement has been used to support new work just getting off the ground, as well as work that's been going on for generations. Next slide, please. Thank you. So to start, since I was asked to speak to the evidence base for the action steps recommended by the statement, I do want to first discuss the role of research broadly in this work. And I start here because there are many examples of where a need for data or more research is invoked to delay or to refrain from taking action. And I acknowledge a real tension here in that acting on limited information can unintentionally create harm, but at the same time, not acting essentially guarantees it. So this is a tension we have to contend with much in the way that we are addressing the COVID outbreak. We have to act on what we know. We must simultaneously document, and all of this needs to be done with the goal being that each further informs, holds accountable, and assures the success of the other. And as we document, we have to do this in a way that incorporates multiple sources of data, identifies where there may be gaps, and seeks to fill them. So rather than allow the data we have available to limit the research questions that we ask, we have to mobilize to generate the data that we need to inform and support targeted public health intervention. Next slide. So given this grounding, the statement was informed by multiple sources of data, including the academic literature spanning public health, medicine, sociology, legal studies, and beyond, but especially recognizing that particularly where public health research is concerned, work examining law enforcement violence specifically is relatively recent. We were sure to incorporate other sources of information as well. These included governmental and non-governmental organizations like the CDC, the National Education Policy Center, Justice Policy Institute, also advocacy literature like the Movement for Black Lives platform, organizing relationships with folks who've been engaged in this work for years and contributed their knowledge to the statement development, and the news media with, for example, The Guardian, which is a UK-based newspaper, being one of the most valid and reliable sources for documentation on lives lost to police violence in the US in 2016. And in gathering this information, the authors pulled all the recommendations that were put forward and tried to understand for which recommendations there was consistent evidence of their effectiveness in intervening on law enforcement violence, and which recommendations were consistent with public health guidance on upstream structural interventions. And so in these next few slides, I'll try to summarize the primary takeaways from that process. Next slide. So first is decriminalization, which is the repeal or narrowing of criminal statutes to remove all or portions of a particular practice from the purview of the criminal legal system, particularly those that promote or justify increased scrutiny of specific populations, like a disproportionate burden of police stops. Proposals around decriminalization are frequently met with concerns that doing so will negatively affect the public's health. For example, in the case of decriminalizing drug possession, concerns have been raised around increases in drug use and increases in traffic accidents. One of the studies cited in the statement evaluated a decision in Portugal to decriminalize all drug use and redirect those resources to provide health services. And they compared this with approaches in Spain and in Italy, which continue to deploy criminal penalties for drug use. And they found improved outcomes under the decriminalization approach, including fewer opiate-related deaths. And then similarly, an effort in New Zealand to fully decriminalize sex work showed evidence of reducing law enforcement contact and improving health outcomes like HIV prevention among sex workers. So this and other examples cited in the statement suggest that there's evidence decriminalization reduces police contacts and improves health. Next slide. The statement also looks at proposals to decrease law enforcement funding and redirect those funds to address the social determinants of health. And with proposals to decrease police budgets, typically the concerns that get raised are around whether this would harm the public's health by reducing police force size, resulting in increases in violent crime. But the literature cited in the statement largely finds across a variety of settings, including communities, including schools, that with changes to law enforcement spending and police force size, data on criminalized activities remain stable. Shifting these funds to the social determinants of health, though, like access to stable housing, educational and employment opportunities, has been linked to reductions in community trauma and interpersonal harm, and improved community health and safety. And then more broadly, improvements in these social determinants have been consistently linked with better physical and mental health. So the statement finds that redirecting funds from policing to the social determinants of health may improve physical and mental health. Next slide. So in an effort to respond to law enforcement violence and its implications for health, several new or newer policing strategies have been proposed, including the 4 that you see listed here. So I'll walk through a few of them, but for those of you who may want more information on each of these, we can provide links to the full statement. So first, community-oriented policing is programming designed to encourage positive non-enforcement interactions between police officers and community members to build public trust. Evaluations of this programming has primarily looked at outcomes like residents' attitudes towards police and perceptions of police legitimacy. And for those outcomes, they find improvements. But across studies that examine the relationship between community-oriented policing and outcomes like community violence and police violence, reviews suggest limited to no effects. Similarly, studies on the use of body cameras have largely found either no relationship with police use of force or increases in use of force and fatal shootings. Some reforms have also called for mandatory implicit bias training based on the idea that the use of force decisions are influenced by unconscious biases. However, again, reviews of studies to assess the effectiveness of these trainings describe the results as mixed at best, with several showing no effects on use of force or decisions to shoot. Importantly, each of these approaches are targeted at the individual level, whereas the statement again prioritizes effective structural intervention. One proposed structural intervention is shifting away from policing and towards community-led strategies for community safety. For example, community-based violence intervention programs that employ unarmed outreach workers who detect and interrupt potentially violent conflicts have been shown to significantly reduce homicides and non-fatal shootings in neighborhoods with the highest numbers of these experiences. So implementing community-led intervention has shown some success in addressing issues of community safety. Next slide. And so the statement goes into police protections like state-based law enforcement officers' bills of rights or police union contracts as well. And it documents concerns raised around hindering or blocking officer accountability. The statement lists several of these concerns, one of which is suppression of law enforcement data related to deaths. And given police departments are not required to report these data publicly, and less than 40% do, there is still no reliable and complete official US data on the number of people killed by police. As I mentioned earlier, there have been several crowdsourced efforts and more localized data collection efforts like the Justice Study in San Francisco that have worked to fill this gap. But again, there's no official national system to do so. And so as a result, there have been calls among public health researchers and clinicians alike to make law enforcement related deaths a notifiable condition, which would allow public health departments to systematically document them. And for those of you who may have participated in the AMA panel yesterday, you would have heard Dr. Mitchell speak to this. So the primary takeaway here is that the public health system has the existing infrastructure to generate and maintain data that can be used to inform and support public health intervention. Next slide. So on this last slide, I just listed the primary takeaways presented in the APHA statement. They summarize interventions that are consistent with public health guidance on upstream structural intervention, emphasizing again, structural intervention as best equipped to simultaneously intervene on the many health outcomes linked to police violence. And again, these interventions include decriminalization, which may reduce police contacts and associated adverse health outcomes, redirecting funds from policing to the social determinants of health, which may improve physical and mental health, implementing community-led interventions, which may address issues of community safety, and using the existing public health system infrastructure to generate and maintain data that can inform and support intervention. So just to finish here, I'll say that as a structural issue with health consequences, addressing law enforcement violence requires structurally targeted interventions that prioritize the public's health and well-being. And with that, I'll hand over to Omid to share the action steps and examples of how the statement has been used.
Thank you, Catherine. Hello, everyone. Thank you. Just want to start off by thanking Human Impact Partners for, as Catherine mentioned, holding this space. Honored to be an advocate and conduit for this long-standing work. You know, I'm virtually connecting with you from occupied Duwamish land, the Coast Salish people, or as you might know as Seattle. A tribe that is not federally recognized, but we recognize as the caretaker of this land, and we thank them, and I thank them for allowing me to be here. This is a powerful network of folks on this call right now, and really fantastic to connect with you and discuss what the action steps of this statement and application of the statement has looked like and can continue to look like. Next slide. So the actual language. So Catherine really brilliantly broke it down for us in terms of the ins and outs of the statement. But we actually look at the language, and we have images here with Black backgrounds and white text. The action steps read as, you know, focus on increasing transparency and accountability. And the language goes, the APHA urges data collection and research on law enforcement violence by the CDC, NIH, National Center for Health Statistics, and full public disclosure of all recordings and investigations of law enforcement officer excessive use of force. APHA also urges state governments to eliminate legislative provisions that protect law enforcement from investigation and accountability, and urges municipal governments to negotiate police union contracts that eliminate protections that prevent investigation and accountability. Next slide. Two more images: demilitarize and decriminalize. Really important pieces. APHA urges governments to reverse the militarization of law enforcement, including by not acquiring or using military equipment and reducing the number and use of SWAT teams. APHA also urges governments, all levels of government, to decriminalize activities shaped by the experience of marginalization, structural marginalization, including but not limited to substance use and possession, sex work, loitering, sleeping in public, minor traffic violations. Next slide. And lastly, a really key aspect of our work as public health folks, advocates, working in, you know, our health departments and other institutions really centered on promoting health and well-being, is APHA urging governments to divest and invest, to urge governments to shift funding from law enforcement agencies to community-based programs. Two things we know as public health folks we know that work: including employment initiatives, affordable housing, education opportunities, transformative justice programs, and non-police mental health response as a few examples. Next slide, please. How the resolution is being used. It can be applied in a lot of different areas. So in terms of policy, we are seeing it and have seen it even prior to the current uprising that we are in, used across the country in city council hearings and local advocacy against the system of policing, again, with this focus on upstream. And, one example was in Baltimore, opposing a bill allowing private universities to establish armed forces. That's just one example, and we'll get into more. Education and narrative change. We can use this statement to discuss and educate the future public health workforce to understand policing and state violence in a public health context, in the context of racism, white supremacy, capitalism. These are all extensions into policing in the system of policing. And that includes immigration enforcement as another example of state violence. In research, we have seen the statement used to advance research. It's referenced, written about in peer-reviewed publications, which is really key and important to shift our public health discourse in ways that actually center those most impacted by health inequities, and in this case, most impacted by policing. And lastly, I'll mention practice, how we can, as public health folks, convene, develop resources, hold space with community events with our movement partners, folks who have been doing this work to practice accountability and center community voices most affected by policing. These are all various ways we've seen the statement get used. I certainly use it in my class that I teach, public health course at the University of Washington on structural racism, public health, and that key framing to understand then what is our work moving forward. Next slide, please. So how is the resolution being used in this moment? Well, APHA policy statements simply are meant to be used, meant to guide health policy. APHA itself is citing this always timely statement and setting the tone for all levels of government across the country to put the policy steps into practice. We have seen the statement be supported by academic institutions. I can speak from the University of Washington, where all the deans, health sciences in the University of Washington, medical school, nursing, social work, pharmacy, dentistry, and of course, the School of Public Health have supported and used the statement. We've seen similar statements in UIC in Chicago, University of Illinois, Chicago, similarly expressing support for the role public health needs to play in this moment and center the policy steps as 10 concrete steps. And for folks who are clicking that link in the chat, you'll see all of the action steps I spoke with you on kind of broken out into 10 concrete steps that public health workers can support and take action on. There are various efforts across the country right now of schools cutting ties with police departments. From other folks in our network, I know that for San Francisco Public Schools, working to cut ties with the San Francisco Police Department, defund the police, folks are citing this statement. And similarly, in the heart of the uprising we're seeing in response to the murder of George Floyd in Minneapolis, as we all, I'm sure, have read, University of Minnesota, Minneapolis Public Schools have moved to terminate its contract with the Minneapolis Police Department. And to that, we must thank protesters for creating the opportunity for the rest of the country to follow suit. They have created that window for us. And I know there are similar efforts here at the University of Washington to decriminalize and cut ties with the Seattle Police Department. And I am sure other folks on the call today can cite similar efforts going on in their own community. I want to lift up as well local government advocacy. Health workers right now, doctors and public health workers are mobilizing to advocate for and make clear demands to our governor and to the city of Seattle, King County, adapting the policy steps from the APHA statement as a set of demands. And a letter with demands on behalf of healthcare workers right now seeking sign-ons is moving and how it can be moved towards actual change that we need in this moment in solidarity with the local Black-led movement that's happening in our area. And I believe we have that letter to share with folks as well. And lastly, I want to lift up, there's been an ongoing advocacy campaign against Seattle Police Department for the use of homeless encampment rules, sweeping homeless encampments. And APHA statement was cited in some recent efforts. In particular, and as folks know, CDC guidance states homeless encampments should not be removed, to not disperse residents of encampments throughout the city, working against any efforts to physically distance and curb COVID-19 transmission, as well as not break ties, relationships with homeless service providers when people are dispersed. A letter was written, then 6 hours, quickly pulled 125 signatures to support a budget ordinance to restrict the use of police and the funding that is directed towards them to remove homeless encampments rather than investing in addressing the structural determinants of homelessness. That's the shift we need and how we can use a statement. And there are other advocacy organizations such as True Colors United, which focuses on LGBTQ young people experiencing homelessness and using this statement as well. Next statement, please, or next slide, please. So, there's a huge movement of work right now, which is just a continuation of the Black-led grassroots work that has been happening for centuries on reallocating resources and instead investing in the community. This statement aligns with that work. And us as public health workers, understanding how we can enter into this moment, how we can contribute constructively, and publicly support with action these community-led efforts is key. It is also that evidence-based public health approach, as Catherine was breaking down for us. So, out here in the Pacific Northwest, Portland, which I happen to also have grown up outside of, recently we saw that headline that Portland Public Schools is removing school resource officers from all its schools. The mayor announced no officer would be in any school in the city, and also that the entire youth services division of the Portland Police Bureau would be disbanded. And there's also recent chat in the Minneapolis City Council to disband the police department entirely. These things are possible and they are supported by public health evidence. In Chicago public schools, there's a similar effort on their hashtag Police Free Schools to move officers outside of educational settings. And again, I'm sure there are countless, and there should be this movement going on in your communities as well. I want to lift up some recent work also in King County. The largest labor coalition is looking to remove the Seattle Police Officers Guild, the local police union, from its membership to reduce the power of police unions. And the statement, and as Catherine was speaking to, really speaks to the way police unions can undermine efforts and counter measures for accountability. And that's definitely absolutely the case happening in our liberal, quote unquote, liberal Seattle, Washington. And lastly, I just want to lift up all the defunding police department campaigns that have been emerging across the country. These aren't new, but they have been reinvigorated in this time, in this moment. Los Angeles, most notable in terms of announcements to cut up to $250 million from police budget, investing in public health, investing in the Black community and other communities of color is really key. Here in Seattle, defund police department, Seattle Police Department campaign has begun. Asking for the budget for the Seattle Police Department to be cut in half, prioritizing community-led health and safety strategies. And as our statement says, full access to affordable housing, community-based alternatives, policing, anti-violence programs, trauma services. These are all efforts that prioritize health rather than criminalization. And New York City, Nashville, Chicago, these are just other cities. And again, the list goes on. Grassroots organizers, abolitionists, Black-led organizations, groups, and collectives have been leading this work for centuries in our current righteous uprising for justice in response to the murder of George Floyd in Minneapolis and countless others, Breonna Taylor and so forth across the country. This evidence-based APHA statement is the access point for us as public health workers to enter into this work, enter into this movement, and support these long-known efforts. We simply cannot and we'll never police our way to public health. And, you know, we are part of health departments and other institutions from across the country, and to use our public health voice, leverage our skills, lift up and advocate for these policy approaches within our work is how we use the statement. We practice community-based public health practice by listening to those in my community, in your community, who have likely been touting similar approaches for years. And we can also shift the public health discourse to address the crisis of racism and policing. You know, alternatives to policing is leaning on what we already know. We know that if housing, education, jobs, food access, healthcare, and every other social determinant of health we can think of was resourced equitably, Black communities and Indigenous communities, for any marginalized communities most harmed by policing, we would have healthy communities and we'd have more just communities. And before I close, and you can click on this slide to allow some remaining text to pop up. I just want to discuss a few community safety and community protection approaches that do not involve police that we are seeing. So Black Organizing Project in Oakland Unified School District, with their work focused on alternatives to school safety without policing, the focus on restorative justice for young people, Black and brown young people, and dismantling the school to prison pipeline. This is key. This works. Anti-Police Terror Project in California has their mental health first, community first response, which is critical for people with mental health issues rather than a police presence. People in crisis who need mental health support actually receiving the proper care, not the harm that they need. And lastly, just want to lift up in Chicago in these COVID-19 times where we're seeing outreach workers who are not working to police, with no police on their teams or on their navigation teams, as we like to call them in Seattle, a euphemism for policing. They are outreach workers, street outreach workers who are already working around gun violence in the city and are now deemed essential personnel by educating residents in their neighborhood, going out into the neighborhood on education around COVID-19 prevention. And before I hand it off back to Christine, I just want to close and ask everyone who is here with us today, thank you for joining, and ask everyone to, you know, use this APHA statement however way you can, cite it, discuss it. You know, it is our access point to the current moment, to this long-standing movement against policing and state violence and racism. And, you know, take the action steps, work within your communities to find alternatives to policing, listen to those in your community, allocate those resources that are currently focused on criminalization and direct them towards prioritizing health and well-being. You know, if we ever needed a time, now is that time. I'll hand it back to you, Christine.
Thank you, both Omid and Catherine, for sharing this work and the action that's been done with it. You're both amazing, and I really appreciate it.